Yesterday, Health and Human Services Secretary Robert F. Kennedy Jr. had a fiery back and forth with senators yesterday on the number of health issues, including vaccines and firings at the CDC. Scripps News Group's reporter Stephanie Lee Bergen joins us now. Stephanie, you were in the room for this multi-hour hearing. What were some of your biggest takeaways?
Hey, Gabby, good morning. Well, this was a 3-hour hearing that was contentious. It was combative. There was literal shouting between Secretary Kennedy and members on both sides of the aisle. So there were a lot of questions yesterday about access to vaccines. During the confirmation process, before he was secretary, Kennedy promised not to do anything to restrict access to vaccines. He promised senators multiple times that he wouldn't do anything to make vaccine access more difficult. And Democrats and Republicans on the Senate Finance Committee were calling him out yesterday for that, saying that he has broken that pledge. They used the recent changes to the COVID-19 vaccine as their prime example. The recommendations recently changed, so it's only recommended for people over 65 or people with an underlying health condition. And in reality, that means places like CVS in states like Virginia and North Carolina are not offering the COVID vaccine, or they're requiring a prescription in order to get the COVID vaccine. There are doctors who say they're not sure about their liability if they write a prescription for the vaccine outside of the official recommendation. So Secretary Kennedy multiple times yesterday told the senators that everyone can get access to the COVID-19 vaccine. But in an exchange with Senator Elizabeth Warren from Massachusetts, she really pressed Secretary Kennedy on what the real world implications are, even though he's saying that everyone has access. Take a listen.
Anybody can get it.
Anybody. So you're saying that is now the official rule of HHS. Anybody is eligible to get a booster by just walking into the pharmacy.
It's not recommended for healthy people.
No. If you don't recommend, then the consequence of that in many states is that you can't walk into a pharmacy and get one. It means insurance companies don't have to cover the $200 or so cost.
There are more vaccine changes that could be around the corner. An advisory panel is due to meet later this month, and they could be changing what is recommended for childhood vaccines, for example. So that was just one of the key issues that came up yesterday. There were also a lot of questions, again, from both sides of the aisle about the recent shakeup at the CDC and the firing of the director, Susan Monarez. Kennedy was pressed on how he went from completely supporting her nomination and, supporting her being sworn in as CDC director and then firing her less than a month later. He rejects the idea that her claims that he asked her to be a rubber stamp for vaccine recommendations, but he did confirm that he asked her to fire some career scientists and public health experts at the CDC, Gabby.
All right, Stephanie, thank you so much for that in-depth recap of what's going on. Of course, we're going to continue to follow this through, and I know you're going to give us the latest details. Thank you again.